Go ahead.
SB 608 is the third year in attempt. I do not give up, as you can see. On ensuring that individuals, young people, have access to be protected should they make that personal decision to be intimate at a younger age. While the bill was vetoed last year, we were able to get funding in the budget for this bill. So now we just need to pass the bill to use the money we've already allocated or have set aside from last year's budget. And in this year's budget, we were also able to get even more funding to help fulfill the requirements of SB 608 that wants to bar school-based health centers from making condoms available. We want to make sure that they have them available for grades 7 to 12. We want to make sure that when there is an educational or health program happening at the school, that they are not prevented from providing contraceptions during those educational hearings or webinars. And we want to make sure that pharmacies and retailers are not asking for an ID because there is no state law requiring for ID to purchase contraception at these locations. And we want to make sure, while not in this health committee purview, we want to make sure that the California Department of Education has the authority to monitor the already established California Healthy Youth Act. With that, Madam Chair, I'll turn over to my first witness in support.
Thanks. You'll have 2 minutes.
Good afternoon, Chair Bonta and Assembly members. My name is Joaquin Avalos, and I just completed my junior year at Da Vinci High School located in Hawthorne, California. I am here on behalf of hundreds of students who are in strong support of Senate Bill 608. I work hard to be healthy, and a part of that is to understand how STIs work and how comprehensive sex education can help me and my friends become healthier. Expanding access to condoms in schools and communities and actually implementing comprehensive sex education would support us to lead healthy lives. California youth, and in particular youth of color like myself and many of my high school peers, are disproportionately affected by the STI crisis. I know for a fact that students in my high school have experienced difficulties in the process of purchasing condoms. For example, some have been judged, some have been asked for ID, some have been shamed, and some even being harassed in the process. Youth with low incomes are often left without the option to regularly use condoms to help protect their health and prevent unintended pregnancy from occurring just because of the cost. My peers and I need comprehensive sex education to make informed choices about our health and our lives. You all are the leaders that can change this. California needs you to take more action. Senate Bill 608 is a solution to this problem. California's youth deserves access. On behalf of students in California, I respectfully urge your aye vote. Thank you very much for your time.
Thank you. You'll have 2 minutes.
Good afternoon, Assemblymember Bonta and committee members. My name is Jubilee Adams. I'm a UCSC student, and I've spent the past 2 years serving as a youth board member with the California School-Based Health Alliance, or CSHA, a co-sponsor of SB 608. In high school, I accessed reproductive health services through my school-based health center. The care and education I received there helped me make informed decisions that kept me healthy and focused on my future. That access made a real difference, and not every student has it. The California Healthy Youth Act guarantees students the right to medically accurate sexual health education, but SB 608 is the necessary next step. CSHA supports 450 school-based health centers and wellness centers in K-12 schools in California. These centers provide comprehensive, confidential care to students facing barriers outside of school, such as cost, transportation, stigma, and lack of privacy. For students in low-income, immigrant, and LGBTQ+ communities, these barriers are even higher. According to the CDC, 21% of California high school students were sexually active in 2023, and 52% of them did not use a condom during their last sexual encounter. Teens are often shamed or denied service when trying to purchase condoms, or even asked for ID, despite no age requirement existing. SB 608 addresses this directly and ensures that school-based health centers can distribute free condoms as a proven harm reduction strategy. Increasing access to condoms does not mean an increase in sexual activity. It increases safety. Some high schools already provide free condoms. SB 608 ensures a fair, uniform approach so that all students have the same opportunity to protect their health. Thank you all for your time, and I respectfully urge your aye vote.
Thank you so much. We are going to move now to any of those in the hearing room who aren't in support of this measure with your name, affiliation, and position. We need the mic on.
Yeah. Chair and members, Kathy Mossberg on behalf of Essential Access Health and Black Women for Wellness Action Fund, both co-sponsors, as well as APLA Health and SFAF, San Francisco AIDS Foundation. Thank you.
Thank you.
Thank you, Chair and members. Angela Pontus on behalf of Planned Parenthood Affiliates of California in support.
Ryan Spencer on behalf of the American College of OBGYNs, District 9 in support.
Nicole Wortelman on behalf of the Children's Partnership in support.
Madam Chair and members, Rand Martin on behalf of the AIDS Healthcare Foundation in very strong support of this bill. Thank you.
Martin Radosevich on behalf of Reproductive Freedom for All California in support.
Kasha Hunt with Political Solutions here on behalf of American Academy of Pediatrics in support.
Angela Hill with the California Medical Association in support.
Kelly Brooks on behalf of the Board of Supervisors, Santa Clara County in support.
Madam Chair and members, Dennis Cuevas Romero with the California Primary Care Association Advocates in support.
Good afternoon, Karen Stout here on behalf of the California Nurse Midwives Association in support. Thank you.
Nora Angeles with Children Now in support.
Thank you. We are now going to move to any primary witnesses in opposition. Thanks. You'll have 2 minutes. You'll need to press the button so we can hear you.
Thanks. Chair members, my name is Greg Burt, and I'm with the California Family Council, and we're in opposition to this bill. First, parental authority. California law already gives parents a limited opt-out from sex education. SB 608 builds a separate channel for handing out contraception entirely outside of that framework. Under this bill, a 7th grader could obtain condoms at school with no parental notification at all. Parents are the constitutionally recognized primary decision makers for their children's health and moral formation, and courts have affirmed this for decades. This bill also strips the decision from local school districts. A community that believes handing condoms to 12-year-olds is a bad idea can say so through its elected school board. SB 608 takes that choice away and imposes one answer on every district, no matter what the local parents want. The public health record cuts against this bill too. The CDC's own youth risk behavior survey shows that early sexual initiation correlates with more partners and higher risk behavior. Teens who delay do better. SB 608 pushes the opposite direction by normalizing early sexual activity. And it treats condom access as if it were disease prevention when it's not. The CDC is clear that condoms reduce but do not eliminate the risk, and they are less effective against skin-to-skin infections like HPV, herpes, and syphilis. California is in a congenital syphilis epidemic right now. Handing condoms to minors without honestly communicating these limits creates a false sense of security. Abstinence remains the only method that is 100% effective. Honest policy should say so, and we urge you to invest instead in strengthening the parent-child communication. We encourage you to oppose this bill. Thank you.
Thank you. You'll have 2 minutes.
My name is Pastor Brandon Campbell, and I have served in pastoral ministry for 25 years, 14 of those as a youth pastor, 7 of them teaching in a private school. I am currently the senior pastor of the Faith Baptist Church and the Northern California director for the California Baptist for Biblical Values. I am in opposition to SB 608, this bill expanding condom access in schools and removing age barriers for non-prescription contraceptives. While well-intentioned, I believe it rests on a flawed premise that the solution to rising STD rates among youth is to make condoms more available and encourage them. According to the CDC, condoms do not prevent the spread of all sexually transmitted diseases. For example, they offer limited or no protection against diseases like syphilis that are transmitted through skin-to-skin contact. Constant and correct condom use does reduce the risk of some fluid-transmitted infections, but it cannot provide absolute protection against any STD. Encouraging young people to participate in sexual activity with the promise of protection is not the answer. Instead, we should courageously promote the healthiest choice, abstinence from sexual activity until marriage. This approach lines with both CDC statements, public health reality, and biblical values. As the Bible states in Hebrews 13:4, marriage is honorable in all, and the bed undefiled. Our young people deserve better than risk reduction strategies that accept premature sexual activity as inevitable. They deserve a message of hope, self-control, and the profound benefits of waiting. I urge you to reject SB 608 and prioritize policies that truly protect California's youth. Thank you very much.
Thank you. Are there others in the hearing room who would like to register opposition? Please come forward.
Hi, David Bolog, SFE Alliance, representing parents and families in Senator Menjivar's own 20th Senate District in opposition. Thank you.
Christine Campbell, concerned parent, in opposition.
Florentina DeGennaro, representing Moms Army, thousands of moms in California, also representing Church of God Tidings and Freedom Coalition in opposition.
Thank you. Seeing no other opposition, I will bring it back to the committee for any comments or questions. Moved by Ahrens, seconded by Caloza. Senator, I want to thank you for bringing forward this measure. I know that this is also one that you've had to review and kind of reconsider over time. I think that you've sufficiently addressed the concerns that have been addressed in the prior legislation. And with that, I will certainly be supporting this bill. I want to thank everybody for offering their testimony, particularly the students who are coming from their schools to be able to share what they want to have happen in their schools. With that, would you like to close?
Y'all kept it short and simple, so just respectfully asking for an aye vote.
Thank you. And when we have quorum, we will be able to consider that.